This lecture is about the integumentary system. Before having a look at the main skin problems, let's have a histological recap. The skin consists of three principal parts. The superficial portion, which is composed of epithelial tissue, is called the epidermis. The epidermis is composed of keratinized stratified squamous cells. About 90% of the epidermal cells are keratinocytes, 8% are melanocytes, and 2% are Langerhans cells and Merkel cells. The epidermis is attached to the deeper, thicker connective tissue part called the dermis. The dermis is composed of collagen and elastic fibers and a few cells. Deep to the dermis is a subcutaneous layer, or called subq. This layer, also called the superficial fascia or hypodermis, consists of areola and adipose tissue. Among the epidermal derivatives, let's name the hair and the hairs, which protect from injury, sun rays, foreign particles, or insects. The glands, among which several are associated with the skin. Sebaceous or oil glands that secrete sebum, sudoriferous or sweat glands, ceruminous that secrete cerumen, and mammary glands, which are modified sudoriferous glands that secrete milk. The nails. Now let's review the most common skin lesions. A cold sore or fever blister is a painful blister usually on the lip caused by herpes simplex type 1. A plantar and palmar wart is usually a harmless growth caused by a virus. A cyst is an unusual growth containing liquid or semi-liquid substances. A corn is a hard, painful lump of skin usually on the foot. Sunburn or erythema is a damage to the skin due to excessive exposure to sunlight. A rash is a mass of small spots. Eczema is a non-contagious inflammation of the skin with an itchy rash and blisters. Hives or urticaria is an allergic reaction where the skin forms irritating reddish patches. Lichen planus is a skin disease where itchy purple spots appear on the arms and thighs. Vitiligo is a condition in which white patches appear on the skin. Acne is an inflammation of the sebaceous glands which makes blackheads appear on the skin. Psoriasis is an inflammation of the skin. It's a disease where red patches of skin are covered with white scales. Cellulitis. It's the bacterial inflammation of connective tissue or of the subcutaneous tissue. A boil or furuncle is a tender raised mass of infected tissue and skin. With our next slide, we're going to review the questions you should ask if your patient presents with a skin lesion. First, let's inquire about the site of commencement. Where did the lesion start? That would be your question. You may want to know more about the nature of the lesion. Is the lesion itchy, oozing, smelly? The pain. Is the lesion painful? Does the lesion hurt? The pattern of spread. Have you noticed that it has spread? The progress of the lesion. Have you noticed that the lesion has grown. Response to the treatment. Have you noticed any improvement with the cream, the ointment, the gel? Presence of associated symptoms. Have you noticed anything else such as fever, fatigue, dizziness, and nausea? Now let's pass on to diagnostic tools and treatment option. One procedure is a punch biopsy. Skin scraping as well help diagnose fungal infections and scabies. A wood light, also called a black light, can help clinicians diagnose and define the extent of lesions. Dioscopy is used to determine whether a lesion is vascular, non-vascular, or hemorrhagic. As for treatments, most are topical treatments, creams, ointments. You can also prescribe oral antibiotics, corticosteroids, laser therapy, and also cryosurgery. Thank you for your attention.